Good afternoon, folks. This afternoon's topic is pain related, so we'll get into that as soon as I get this all situated. I'll be right with you. Okay, here we go. Pain evolves with rest and self-care. Certain signs demand immediate medical evaluation. Everyday everyday back pain versus serious underlying causes. Typical strain, pain after lifting, sitting too long, or sleeping awkwardly. Usually improves with stretching, rest, or over the counter remedies. Serious causes, pain that persists, worsens, or follows unusual patterns. These may stem from spinal cord compression, uh, cardia, interpreting pain, why your back pain could be a sign of something more serious. Okay, here we go. Back pain is one of the most common complaints worldwide, often linked to everyday strain, posture, or aging. But when a page carries a headline like this, it is signaling caution. Not all back pain is beginning. Surrounding content typically distinguishes between ordinary aches and red flag symptoms, patterns that may indicate urgent or hidden conditions, such as nerve compression, infection, fracture, cancer, or systematic illness. This measure, this this message is clear. While most back pain uh, is equina syndrome, vertebrae related, or vertebrae fractures, infections, or even uh, melanosis. Many many pages emphasize that younger adults often experience lifestyle related pain, while older adults may face arthritis or degenerative changes. Yet, yet emergencies can occur at any age when red flags are present. Red flags that should never be ignored. Neurologic defects, sudden weakness, drop foot, or spreading Numbness suggests nerve or spinal cord involvement. Bowel and bladder changes. New incontinence or retention or numbness in the saddle region. Point to Cauda equina syndrome, a medical emergency. Night/rest pain, pain that disturbs sleep or occurs without activity. Many indicate infection, tumor, or fracture. Systematic symptoms: fever, chills, unexplained weight loss, or a history of cancer raise suspicion for infection or malignancy. Trauma or fragility, falls, accidents, or osteoporosis increases fracture risk. Escalating pain, pain that worsens despite conservative care, may reflect structural or inflammatory disease. Many resources condense these into 5 urgent warning signs: neurologic defects, bowel and bladder changes, systematic illness, trauma, osteoporosis, and night/rest pain. Cautions often highlighted in these discussions: nerve compression, radicular radiculopathy, shooting pain, tingling or weakness down the leg, sciatica. Progressive deflects are especially concerning. Cauda equina syndrome, rare but critical, involves saddle anesthesia and bowel and bladder dysfunction due to severe nerve compression, spinal infection, epidural abscess, or osteomalacia, often accompanied by fever or systematic illness, sometimes linked to recent surgery or immune compromise. Cancer-related pain, deep persistent pain, often worse at night, sometimes tied to cancers like pancreatic or spinal metastases. Fractures, sudden pain after trauma, or in those with osteoporosis, or long-term steroid use, sometimes accompanied by spinal deformity. What these pages urge readers to do. Okay. Give me 1 second, folks. Act quickly on red flags. Seek urgent care if neurologic, bowel, bladder, systematic trauma related, or night rest pain signs appear. Know the difference. If pain resembles routine strain and improves within days or weeks, home care may suffice. If not, medical evaluation is essential. Fracture in personal context, age, medical history, and recent injuries shape whether back pain signals something more serious. The takeaway, the headline, why your back pain could be a signal of something more serious, is less about alarmism and more about awareness. It reminds readers that while back pain is common, certain patterns can reveal hidden emergencies. Recognizing these red flags and acting promptly can make the difference between routine recovery and preventing long-term disability. Okay, guys, that is A for you. Now, when I do like live shows with the chat on, you guys have the option to ask me questions during the show or after. Okay, that's what the chat is for. So with that being said, if anybody has any questions they want to ask me about this show, particularly, I'm going to sit here like for 15 minutes on this show and see if anybody has questions for me about back pain for today for A. If not, then we'll get going with another show.